Hello, I'm Dr. Dana Brackney. I'm Associate Professor of Nursing at Appalachian State University, and this following presentation reviews Module 1 content related to harms of substance use. The outcomes of screening tools used to assess substance use behaviors are usually described with the following terms: hazardous drinking, at-risk drinking, healthy alcohol limits, binge drinking, low risk, no risk, and more. However, it's important to note that the commonly used term alcoholic is not synonymous with at-risk. Alcoholic is a term related to alcohol dependency, and it's one that people commonly use, but is not related to what we're doing here. SBIRT is about harm reduction, the harm reduction process that we use to screen all people for substance use risk. The historical risk distribution of people screened places the majority of our population at no or low risk. People in this category of risk need to be affirmed in their behavior of abstaining from substance use, and even those at low risk can be informed that increased use could place them at risk or dependent on substances. Those that are identified as at risk and dependent need to know that their substance use places them at increased risk for injury, perhaps social problems, even criminal justice involvement related to driving under the influence or child endangerment, mental health consequences such as anxiety and depression, even work-related problems such as being absent or having workplace injuries. Use of alcohol by teens is particularly concerning. Teens 12 to 20 consumed 11% of all alcohol sold in the US, and 90% of their consumption is binge drinking, which is defined as having 4 or more drinks for girls or 5 or more drinks for guys on one occasion. Most alcohol consumed by young teens, ages 12 through 14, is obtained without financial cost to the teen. This is very important for parents to be aware of because alcohol in their home may be diverted to teen use. Brain physiology and development place the teen brain at increased risk related to physical and mental health, as well as the legal or developmental risks related to underage drinking, such as DUI and academic challenges. So let's take a moment. Many of you are or were at one time a teen. What problems have you noticed in the short term when binge drinking occurs? Sadly, binge drinking is not uncommon. The U.S. Department of Health and Human Services reported on teen survey data and identified that 4.3 million teens reported binge drinking at least once in the past month, and another 861,000 reported binge drinking on 5 or more days over the past month. This bar graph illustrates the dramatic increase in alcohol use among older teens. Numbers for guys and gals are similar, except that 14 to 15-year-old girls binge drink more than boys of the same age. By the age of 16 to 17 years old, boys and girls have similar use. However, girls drink more alcohol than boys across all teen subgroups. Assessment and reduction of binge drinking is necessary to reduce harms and death. This list provides both long-term on the right and short-term on the left column consequences of binge drinking. Some of these could be considered both immediate and long-term consequences. Sadly, every year nationally, and even on our own campus, we hear of the death of older teens due to binge drinking. Let's look at the data for college students. Survey data from the National Institute on Drug Abuse indicated that 33% of college students had been binge drinking in the 2 weeks prior to the survey. 7.6% of students ages 19 to 20 reported having 10 or more drinks on at least one occasion, and 14% of students ages 21 to 22 reported having 10 or more drinks on at least one occasion. College students who exceed daily drinking limits are exposed to harms associated with unsafe sex, sexual abuse, and academic problems. One of our most recent App State data on our most recent from fall of 2015, the survey indicated that 21% reported binge drinking of those who responded. However, it should be noted that there were only 7% survey response rate, and that's considered pretty low for the validity of the survey data. This number indicates that we are likely fairly close to national average reporting. The App State 27-2018 alcohol and other drug data demonstrated that a majority of students use alcohol, and a majority of these students used alcohol prior to college. About a third of students use marijuana, and most of those were users prior to college. 4% of students use prescription, pain, or other illicit drugs, and half of those using these other illicit drugs began prior their use prior to college. So locally, a large number of students could benefit from harm reduction related to substance use. In 2020, during COVID, the use of alcohol, especially among those ages 30 to 59, increased 19% from 2019. It's hypothesized that this age group might be using alcohol to cope with work and home demands related to schooling of children and working from home, or being at risk and working in the community. Use of alcohol to cope is a behavioral pattern that could lead to dependence. Overall, men increased alcohol use by 14%, and women increased use by 17%. Women's use is particularly concerning, with concomitant increase in the rate of pregnancy. Let's take a look at some marijuana facts. Marijuana activates the endocannabinoid system to alter brain activity. About 1 in 10 people become addicted to marijuana, and addiction rates increase 60% in those beginning prior to the age of 18. Marijuana is stored in fat, and the brain is 60% fat. In states with legalized marijuana, children who have higher body fat percentage than adults are being exposed through unintentional consumption of edibles and through breastfeeding. The physical and mental benefits of marijuana have been demonstrated for 2 populations: those with specific, otherwise unmanageable epilepsy, and those with terminal cancers. The harmful effects of marijuana are not popular to discuss in the general public. The general public believes marijuana to be harmless. The studies reported here are associations. What we do not know is if people prone to mental health disorders are self-medicating, similar to alcohol use, or if marijuana is causing these outcomes. We do know that physical performance is decreased with marijuana use, and that relationships and productivity as measured by employment are decreased among those who use. There is strong evidence for the decreased cognitive function among users with long-term and heavy daily use as measured by IQ and mortality. Other documented harms include severe nausea and vomiting. I find this especially interesting because some cancer patients use marijuana to control their nausea and vomiting. There are newly released studies on the effects of marijuana and infants of mothers who use during pregnancy, and these reports found negative outcomes for infants. Use of marijuana during pregnancy and while breastfeeding is not advised by the Academy of Pediatricians. The increased oxygen demands by increased heart rate increase the occurrence of myocardial infarction among marijuana users. Marijuana users have more respiratory complaints and illnesses than matched pairs of non-users. Marijuana use is largely accepted in the US. This is due to changes in public opinion and in part response to abuses of the justice system and severe punishments for marijuana possession. However, experimental study of the causes of healing and harms related to the effect of marijuana are lacking. People in general can be suspicious of science, and so the use of harm reduction techniques and the use of evidence-based practice by healthcare professionals is an important role to protect the public from these harms. The craft screening tool for teens now includes a vaping question. Vaping is popular due to it being less noticeable by parents and employers. Vaping of THC and nicotine has been dramatically increasing among teens and needs to be included in screenings regarding substance use. The craft screening, and here it is about the craft tool. Okay. It comes down to respect. SBIRT for Youth is a brief intervention. Multiple professionals use screening combined with motivational interviewing with positive personal regard and openness for teens. In my experience, teens welcome these conversations because the purpose is not punitive or judgmental, and it empowers teens to make informed choices about their health. However, use of motivational interviewing takes practice. Each encounter is different and requires skillful interviewer to get results. This is likely why the research shows ineffectiveness in SBIRT outcomes. Not working with teens? Well, no worries. SBIRT's for everyone. It is universal and most people can benefit from harm reduction of some sort. There are lots of resources on the aging population and as you learn as well. Thanks for attending this review into the harms and risks of substance use.